In this video, I'm talking specifically about two treatments that are specific to cancer and cancer-related diagnoses. Sometimes some other ones, but for the most part, it's cancer-related. And this is chemotherapy and radiation. And especially, particularly when it's labeled as palliative chemotherapy and or palliative radiation. There are many things to cover and understand here. My name is Abigail. I'm here to normalize these conversations and education about death and dying so we all die better at the end of life and continue to use death as the really significant tool that it is to create value until we get there. So let's get into it today. A significant frustration when I was working in hospice and palliative care was when we were talking to or working with a patient who had cancer, and it was clear to us from our professional assessments and medical determination that this person was going to die within weeks. And this happened so many times, this is why I'm doing a video, where the oncologist told the family that they could offer them palliative radiation and or palliative chemotherapy. And the patient and family were just like, yeah, if the doctor says it, then let's go ahead and do it. And what I will do is first to take a pause here, which I intended to do, and intended to start with this. So let me stop here and just start with this. I am not an oncologist. I'm a registered nurse, but I am a hospice and palliative care professional. And this has been my field of expertise. And even though I'm not an oncologist, I want to first stay here and just let you know that I know I'm not an oncologist, and I realize that there are certain cases here where what I'm talking about may not apply 100%. I understand that. But the most important thing, the most important takeaway, and I will get into more of these things to help you understand, but the most important takeaway that I need you to understand, particularly if you're being told by an oncologist or a physician or somebody that you can pursue palliative chemotherapy and palliative radiation, is you need to really fully understand what the goals are with that palliative chemotherapy or radiation, what that doctor who's providing it intends to achieve, and within what time frame, and lastly, are the results that they're expecting, are those going to override the side effects, the side effects of the radiation and chemotherapy? Because you may know already, if you've been diagnosed with cancer and pursued with treatments already, that the side effects of chemotherapy and radiation are quite uncomfortable, and they really do alter quality of life for the most part, for most people. Some people can deal with that a little bit better, but for the most part, the side effects are quite severe, particularly as we're getting close to end of life, because the reserves are getting less and the person isn't able to utilize that treatment as well. So what I want to say first, before I go into my spiel, is you need to first and foremost, you can stop the video here if you want to, you need to first and foremost really understand. Ask and demand of your physician to explain to you in full what all this means and what they hope to achieve. When doctors say to patients and families about, palliative radiation chemotherapy, they basically, most of the time, what I have seen is that there's this false hope that is created for this patient family, because they start to think, oh, that means I can still do this treatment and I can get better from cancer. First of all, what I need you to understand is when someone says palliative, and this is why you should already be on palliative care even if you're getting cancer treatment for a cure, palliative care is symptom management. Symptom management. So this is why if you're diagnosed with a chronic illness, Alzheimer's, if you're dealing with a serious illness, also cancer, multiple sclerosis, heart disease, emphysema, any serious illness and or a chronic condition, you should be receiving palliative care, because what palliative care will do is it will ensure that your symptoms are managed, particularly as you get sicker or maybe as you get better, but managed not only through the illness but also through the treatment, because treatments themselves can be just really, really harsh on the body. What we first need to understand is, especially as we're nearing end of life, the body loses the reserves to actually, and when it loses reserves, you're dealing with multiple organ failure, you're dealing with poor nutritional status, many, many things that are keeping you from utilizing the treatment at its full potential. So your liver's not working well, so the chemotherapy is going to destroy it a bit more. You're not able to heal as well. After these treatments, you're more exhausted, you're developing more fatigue. You can go to the hospital and get a radiation treatment, but then you come back and it's like you're out for the rest of the day, if not 2 days, if not the whole entire week. Plus dealing with all the nausea, vomiting, the constipation, the diarrhea, the mouth sores, keeping you from maintaining adequate hydration and nutrition. Those are just kind of the real basic things that are keeping you from really utilizing the treatments in full and really recuperating. So not only are you not able to cure from a cancer that has already been making you as sick as you may be, to the point where you're close to being terminal or are terminal, but if you were to throw in palliative radiation and chemotherapy, that can still create the same severe symptoms and impact your quality of life, especially on your minimal time here on the planet. So what I want to say too is, when we're looking at palliative chemotherapy and radiation, this is why you need to really ask your doctor. You need to ask your doctor specifically, what are you hoping to get out of this? What should I be hoping to get out of this chemotherapy and radiation that you're saying is palliative? So remember, palliative is for symptom management. So what symptom are we treating with this palliative chemotherapy and or radiation? What symptom? Is it pain? Is it inflammation? Is it seizures? Is it, whatever it may be? Pressure on certain areas of the body that create other symptoms. What specific thing are we palliating here? And what needs to happen in order for those symptoms to go away or to lessen? Most oftentimes, in order to palliate a symptom, you have to shrink the size of the tumor or metastases. And if those tumors or metastases haven't shrunk already in response to treatment, then I really am doubtful that, and again, I'm not an oncologist, but then you really need to ask your doctor, will I really be able to shrink my tumors and metastases enough to eliminate the pain, to eliminate these other issues and symptoms that I'm having that are causing distress, that are impacting my quality of life? Will my tumors shrink enough? And how much do they have to shrink? Even though it may be only 0.5 millimeter or a millimeter, getting a tumor to shrink or metastases to shrink that much is actually quite a lot. And you might need a lot of treatment to do that. And you may not even achieve that decrease in size of your tumors or metastases to have the true palliation of your symptoms. Okay, so you really need to just be specific and ask them, what are we expecting specifically from this palliative chemotherapy or radiation? What are we expecting it to treat in terms of my symptoms? How is it going to make it better? And by what time frame? So if I'm doing palliative radiation, how many sessions do I need to have in order for us to obtain possibly a decrease in the size of my tumor or metastases to decrease my level of pain? And is my pain going to be decreased completely? Will it be a 0 out of 10, or will it just be a 5 out of 10? What is it going to be? Because you need to be educated. And I always say, and when I was talking to my staff, I always said, we need to be able to have the most informed decision-making for our patients and families. So you can walk away from this video and decide to go ahead and do this. I don't care. What I want you to do is be able to make the most informed decisions and not be misled. And I'm not going to say oncologists are bad at all, no. But what I have found in my experience is that they tend to keep throwing these other treatments and clinical trials. That's another video that we will need to get into, because there's a lot of misinformation around that, things like that. And people walk away with, an unrealistic hope for their situation. And then they're later disappointed after really suffering through these treatments that really impact their quality of life. Okay. So anyway, we covered making sure, what usually needs to happen for symptoms to be removed or palliated with cancer in particular, usually you need to have a decrease in size, decrease in the swelling, that kind of stuff. Palliative radiation chemotherapy, the aim is usually to decrease the size of the tumor and or metastases. And, you want to ask specifically what symptom that this palliative radiation and chemotherapy is treating, how long these treatments need to occur for those symptoms to go away, and to what extent are they going to go away. And then secondly, you need to make sure to ask, is this going to be worth it in the end? If, and is it going to override my experience with the side effects of these treatments? Is it going to be worth going through all this if I'm experiencing extreme fatigue, extreme nausea, the mouth sores, not able to enjoy my favorite foods, particularly around the holidays? We're in the holidays now. Are your side effects of these, chemotherapy and radiation, are they going to impact your time with your family to the point where you won't be able to actually enjoy the time with your family? And your quality of life and your length of life, how are those going to be? And how are you going to weigh all those and ensure that pursuing this palliative care, this palliative radiation chemotherapy, ensuring that it really is going to be worth it in the end? And are you still going to die in 3 months if you have this palliative radiation chemotherapy? If you're truly looking at palliating symptoms, based on my experience, my 15 years in hospice and palliative care, about 20 years in medical, 5 of those before being mostly oncology and critical care, you can palliate symptoms typically of, an oncology type of situation of cancer medically without chemotherapy, without palliative radiation, without radiation. You can manage symptoms of someone with a cancer diagnosis who's at end stage of life without doing this chemotherapy and radiation. If you're dealing with swelling, you can use certain steroids and other medications to minimize the swelling, help with the energy levels, help with the pain, all those kinds of things. I'm not talking about being snowed on morphine. That's not what I'm talking about. But using the expertise of a palliative physician, hospice physician, to manage your symptoms, not just using narcotics, but also working with your mouth, with treating your mouth sores, treating your nausea, treating your pain, treating your shortness of breath, treating your diarrhea, all these signs that you're dealing with all the time, and helping you palliate those, truly palliating those with the right medication regimen. And not only that, but other holistic measures, aromatherapy, visualization, pet therapy, art therapy, all these things. And this is why palliative care and hospice care are so wonderful, because they are so holistic. So I encourage you to make the most informed decision as possible. Ask the questions. You need to demand true understanding of what it means when a doctor throws a treatment at you, particularly when they say it's palliative radiation, palliative chemotherapy. Again, ask them specifically, what is this treatment supposed to palliate? What symptom is going to go away or at least lessen to improve my quality of life? Okay? What has to happen with this treatment specifically in order for my symptom to go away? Meaning, what are we looking for? Are we looking at decrease in size of my main tumor, the primary tumor? Am I looking at the decrease in size of metastases? What are we looking at, and how much size does it need to decrease? What inflammation needs to go down? What specifically needs to happen for my symptoms to go away? How long is the treatment? And is this treatment going to be successful? And if it is it going to override all the side effects that I'm going to be experiencing with the chemotherapy and radiation? And how much is it impacting my quality of life? Specifically, I want to know, how is it going to impact my day-to-day? And what are my other options then? If I work with my palliative physician, if I work with my hospice team, can they give me medications to manage my swelling? Can they give me medications to manage my pain? Medications to manage my nausea? Can they do other things? And maybe I'm just not medication focused. I want to focus on other things like aromatherapy, visualization, meditation, pet therapy, all those things, music therapy, and I want to work in all these other types of therapies to really enhance my quality of life and my comfort. Okay? Let me know if this was needing any types of clarification for you at all, if this was helpful, or if you have any other questions, please put them in the comments. I will make sure I read every single comment, because I need to make sure that you are all getting the information that you need, and that we continue to normalize these conversations and education about death and dying, so we die better at the end of life. I'm Abigail. I will see you soon.